the pastor, and two ladies, Madam Alice and Madam Jerry, through whose connection I am here today. And I want to say that I am a Christian as well, and I love the Lord, and I am a champion on matters to do with mental health. How many have heard of Chiromo? Just Chiromo. Let's see your hands properly. So which Chiromo have you heard of? The school? The mortuary? The rehab? Right, so I am here representing Chiromo Hospital Group. I am by no means from the mortuary. It is a very famous name, but it's just a coincidence that we share the same name. But I'm from Chiromo Hospital Group, and what we do is purely mental health. If you came to Chiromo Hospital and you have a broken leg, we'd probably do first aid and then send you to the nearest medical facility for better care. So with the introductions aside, I want us to quickly do an exercise. And I will request all of us to stand up. If you're physically able, let us all stand up. So I am here to demystify mental health. Do we all have mental health? Do we all have mental health? Okay, so you're convinced that we all have mental health, right? So what we want to demystify is mental health and mental illnesses, right? Now, I'm going to ask you very simple questions. And if your answer to the question I will ask is yes, kindly sit down, right? Once you sit down and I ask the next question and you say, that one I want to answer, don't stand up. So you've sat. Are we together? So I'll ask a question. If your answer is yes, you do what? You sit. So question number 1. I am very happy with every aspect of my physical body. My height, my nose, the color of my skin, how big or small I am very happy with my body. If you're happy, please sit down. Usiangalie kama pastor ameketi ndio uketi. Hapo sitaongea sana, lakini kuna kitu imetendeka hapo. Yeah? Okay, let us all stand up. I will ask different questions. Hapo tunasemanga mmefanya nini? Mmeninyoa. Si ndio? Okay. Now, if your answer is yes, please sit down. When I talk about work, it could be your white-collar job, it could be your mjengo, it could be your kiosk, it could be wherever you wake up to go and do what? And make a living for yourself. Hata kama uko retired, kuna mahali unaendanga unatoa pesa. Right, so tomorrow is Monday. Now, my question is, or my statement will be, I am very happy every morning to go to work. I look forward. Nasikianga Monday ndio hiyo, I can hardly wait for 6 a.m. for myself to wake up and prepare to go to work. I am very happy. Aye. Where are the employers? I am very happy. If your answer is yes, you do what? You sit down. Okay. I have not said you sit down. I have said if your answer is yes, you do what? You sit down. Number 2, I sleep 8 hours every night. Sound sleep like a baby. I don't know who said people sleep like babies, because for those of us who are parents, babies sometimes don't even sleep, right? But just to use that for the sake of your understanding, I sleep very well, 8 hours every night. How many of us, at least over the last 2 weeks, have slept every day 8 hours? Nalala vizuri, naamkia vizuri, naenda job. Okay. The next question. If I were to lose my job or my source of income, I would maintain the same standard of living for up to 6 months, at least 6 months. If I were to lose my job or my source of income, I would maintain the same standard of living for at least 6 months. If I am driving, siwezi kosa mafuta, rent sitasumbuliwa na landlord, Chakula, tutakula the same way. If we are going to entertain ourselves with the family, we will still go. I would maintain the same standard of living. Okay? I have at least 3 good friends on whom I would call upon if I had an emergency and they would come running. At least 3. Unajua for sure, huyo ukimpigia simu hivi. Wow. Oh, the ones behind me are all seated, eh? Okay. Right, all right, so let's see. I exercise or go to the gym or take a walk or take care of my physical health at least every day. At least every? Okay. I have not felt hopeless or helpless over the last 2 weeks. Sijamaliza maswali. My questions are still there. Okay. So the questions that I have asked you, what are they alluding to? We are talking from a point of what? Of mental health, mental wellness. So I think you have the slides, and I want us to look at the definition of what mental health is all about. But before we talk about mental health, let us define generally what is health. And health, according to the World Health Organization, is a state of complete physical, mental, and social well-being. Okay? A state of complete physical, mental, and social well-being. So if you're physically healthy, then we are saying, I don't have a cold, I don't have malaria, I don't have COVID, I am physically healthy. Now, we will define mental health, so let us keep that. When we talk about social, being healthy socially, it includes relationships. How do you relate to the people around you? Are you having healthy relationships? So if we define, you can go down to the next slide, then what mental health is, the World Health Organization says it is a state of well-being in which every individual is able to, number one, realize their own or their full potential. Now, when we talk about potential, when you go to your place of work, or maybe I can give the example of when you're in primary school or high school, and would get report cards, right? And the teacher would say, Victoria, you're scoring 60% in mathematics, but you have the potential to score 80%. So it means at your place of work or wherever it is that you spend your day, you're not realizing your full potential. So if you're not realizing your full potential, number one, your mental health is already compromised, right? Then number two, are you able to cope with the normal stresses of life? Now, where do stresses come from? They come from a lot of factors, right? And we will look at the stressors. So are you able to cope with the normal stresses of life? Number three, are you being productive or fruitful? Wherever it is you get your daily bread. At the end of the day, when someone asks you, what have you been doing? Are you able to say, I have seen so many clients, I have sold so many things, I have done 1, 2, 3, or will you say, tuko tu, tulikuwa tu, right? Because that is a very Kenyan way of answering things. How are you? Tuko tu, isn't it? Are you being productive? Are you being fruitful? And then, are you making a contribution to your community? Now, your community is basically where you're thriving. If, for example, Deacon Fulani is not in church today, has something gone undone because that deacon is not there? And you say, if Deacon so-and-so was here, this would have been taken care of. It means they're making a contribution to what? To the community. So for you to check your mental health, you only need to answer those 4 questions. Number 1, am I realizing my full potential? Number 2, am I coping with the normal stresses of life? Am I productive or fruitful? And am I making a contribution to the community? Now, we've all agreed that we have mental health, isn't it? Do we have mental health problems? Do we all have mental health problems at some point? Remember, I'm talking about problems, not illnesses. Sindio? With the Finance Act, ukipata mshahara, unajaribu kubudget rent, pocket money, fare, haitoshi. So unapatana naye kwa barabara ukijiongelesha, ujatupa mbao. Right? At that point in time, we would not say you have a mental illness, but we would say you're having mental problems because your finances are not balancing. So you're having a problem with your mental health. So if you look at it, the next slide, we've defined what mental health is. Then we do have mental health issues or mental health problems, and then we have mental illnesses, which is the core of what you need to understand for you to understand your mental health better. So when we talk about mental health illnesses, let's go to the next slide. This is what comes to mind. Isn't it? Now that's the narrative. When you hear someone is mentally unstable, immediately your mind goes to what? People on the street, picking papers, people running around naked, people who are talking to themselves. That is what you understand by poor mental health or mental illnesses. But the next slide, the reality of mental illnesses, it could be that deacon in your church, right? It could be that song leader. It could be that brother or sister you're seated next to who actually has a mental illness. Are you in agreement? Isn't it? Yeah? So maybe sometimes in church you see this sister, amechangamka, time ya praise and worship, ndio huyo ameruka, ameimba, amefurahi, na sisemi usifurahi ukiimba. Because again, there's a difference between having a mental illness and your personality. Right? So unaweza pata huyu sister, hii Sunday amechangamka, ameruka, ameimba kwa choir, then next Sunday, she's barely even standing. Unashangaa ni nini huyu sister? Sometimes she's happy, she's very, hyper. Other times, hata ukimsalimia, afanyi nini? Asalimiki. But what have we done because of our cultural background? We've normalized behavior to be, that is how she is. That is how Victoria is. Even when someone asks you, why is Victoria sometimes happy, sometimes she's low. But that could be someone who is experiencing a mental health issue. So it could be all these people you're seeing here. It could be that doctor that you visit, that farmer in the village. It could be that pilot who does what? Who is piloting your plane. So that is the reality of mental illnesses. If we go down to the next slide, then it's important to understand what are they. Now, by definition, we say mental illnesses are a range because there are very many. The catalog on mental illnesses has got about 970 pages describing mental illnesses because they exist on a spectrum, right? So being mentally unwell is not binary. You're not either abnormal or normal, but there's so much in between. But the definition of mental illnesses is that range of conditions which negatively affect your mood, they affect your thinking, and they also affect your behavior. So does alcohol qualify to be in this category? Does it? Does alcohol affect your mood? Positively or negatively? Someone is saying both. Yeah? Does it affect your mood? Does it affect your thinking? Does it affect your behavior? Yeah? So it is officially classified alcohol use disorder is a mental illness. And we look at it when you're discussing the families. So with mental illnesses, most of them are present by around the age of 14 years. So you have this child who behaves in a strange way. And you're not understanding, why is this child having this kind of symptoms? And in Kikuyu, you'll start asking yourself, oyo mwana atoketiye. Isn't it? You will look at yourself, unajiona ukiwa when you're a young man, you grew up very well, you had no problems, no issues, but your child, for some reason, is very heady. In school, they have discipline issues. At home, they're probably even smoking something, right? And you're trying to find out where is this behavior coming from. So most of these illnesses, the symptoms are there by around the age of 14 years, but they go undiagnosed. And most of them start really manifesting themselves from around the age of 24. So the types that we have there, for example, one very common is depression. Now, depression is very interesting because you can have someone who is very depressed, but they're still managing, they're still coping with life. They even come to work, they come to church, they're in the choir, they're the ones who are maybe even preaching, but they are severely depressed because you can mask this depression, okay? Now, there's also what we call, people call it smiling depression, and that's actually the one where you're masking. But there's the typical depression where you feel sad most of the time. So you're not sure why you're feeling sad, but you're feeling very sad all the time. Sometimes you cry all by yourself. Sometimes your appetite really disappears. You have no desire to eat. You feel like, I can't even stand this food. If the depression really, really is not contained, you will find yourself becoming very isolative, which is where someone now starts thinking about doing what? About killing themselves, about suicide. Now, almost 80% of people who kill themselves through suicide are usually very much clinically depressed. So when you start isolating yourself, things which you previously used to enjoy, for example, you enjoyed meeting your friends, you enjoyed doing coffee with your friend, you no longer want to be in the presence of people. So the workmates or people from church will call you for this event, but you keep on saying, I am busy, I'm not able to attend. And that is where now you should check in on people who keep on saying they're not able to come and attend some particular function because they could actually be depressed. But what do we ordinarily do? You invite someone for a baby shower, for a bridal shower, for a rorashio, and they keep on saying no. Typically, what do? We even tell each other, usita Victoria, aendangi, isn't it? And we give up. And the next thing you're hearing, alijua, alijitia nini, kitanzi. Right? So people will kill themselves because of depression. You will see there's a change in appearance. Maybe someone who was very smart is no longer taking care of how they look. They no longer clean themselves up. They no longer go for a haircut. They keep their hair very untidy, just unkempt. And now, especially for men, they start trying to cope with the symptoms by doing what? By drinking, by using marijuana, by using other over-the-counter medication. By the way, if you're buying Panadol and Acto and all those medicines over the counter, anytime you feel a pain, you could also fall in the category of people who are abusing prescription medication, right? Now, it is very interesting. Who do you think suffers more from depression, men or women? Who do you think suffers more from depression? Men. Women. Men, women. I want to hear louder. Men or women? Men seems to be taking the cake, right? But I don't want to say wrong on that. Because women are actually more prone to depression than men. Now you'll ask me the question, but women, we go for chamas. We have friends, we gossip, we talk, we unload, we vent. So why would we be more depressed? But look at the whole background of a woman. She's even more economically disadvantaged. If there's domestic violence, it's a woman who is likely to do what? To suffer. Who goes through hormonal changes, either through their menstruation periods or through childbirth? It is the women. So even though we are biologically wired, we are more prone to getting depressed than the men. Now, the interesting thing is, even if women are more prone to depression, men die more through suicide than the women. A man is 4 times likely to die of suicide than a woman. And we've said that women are more depressed or prone to depression. Why? Because when a man decides he's going to kill himself, it is with finality. So he'll either look for a gun, a knife, hang himself. And I'm not giving you ideas. I always like to clarify that. I'm not giving ideas, right? But men do it to the finality. But we women, maybe we'll take pills, we'll maybe slash our wrists kidogo in the hope, because we're also thinking about children, Women will be a bit more emotional. But when a man decides to kill himself, he will do it with finality. So that is depression for you, and if you're not diagnosed early enough, then it could lead to suicide. Now, the symptoms I've managed, the symptoms that I have mentioned, you must experience them for not less than 2 weeks continually for us to say that you are actually suffering from clinical depression. Then we do have what we call bipolar disorder. Now, bipolar is what I mentioned. You're very happy today, tomorrow you're very sad. People can never place you. So you're not sure. Should I approach this elder today? Anakaa kama amefurahi, kesho ujui amekasirika. So you're not ever sure about this person's emotions. Then we have what we call eating disorders. Now, why would eating be a disorder? It is when it has a psychological underlying. Now, we have young girls, we have daughters, teenagers, or the ones in university. How you communicate to that child, how you talk to her about her body, how does she look like? Do you call her fat? Do you call her thin? Do you tell her she didn't know how to keep herself? Why can't she be like the neighbor's daughter? She may actually get what? An eating disorder. So how does it manifest itself? There are 2 or 3 types, but the normal one is called anorexia nervosa. Now with anorexia, this young girl will refuse to eat. She will starve herself to the point of a medical emergency. So she will not eat. She'll just not eat at all. So you put food there, she will not eat. Now, depending on how you relate with her, you'll not even begin to find out why is this child not eating. Then we have the other one called bulimia nervosa, where the child, yes, will eat, but then she'll do what? She'll go and induce vomiting, right? Image, because of what they've seen in social media as the baseline for what beauty is all about. That for you to be called beautiful, you must have a particular figure, you must look a particular way. And we parents will keep on telling this girl, you're so fat, why can't you slim? Right? But look at yourself also as the parent speaking. How were you when you are that age? Because we say the fruit does not fall far from where? From the tree. So maybe it is actually your genes which are causing this child to be the way they are. So how do we communicate with them? Then we have now one called schizophrenia. Now, schizophrenia is probably the most severe form of mental illness. And the symptoms that you experience, you must have them for not less than 6 months. If you have those symptoms, we will say you're having probably a psychotic illness, but if you have them for up until 6 months, then we'll say you're having what is called schizophrenia. How does it manifest itself? Now, with schizophrenia, you will start hearing voices, okay? We call them audio hallucinations. So you will hear voices, yet when you look around, there's no one talking to you. You will hear voices. You will see things which other people are not seeing, which is why the photographs of the images I've shown of people who are unwell are probably suffering from schizophrenia. So they're out there on the streets, and you see them talking to somebody. In their reality, there's actually someone that they are seeing. So they'll have audio hallucinations. They will have visual hallucinations. They will even smell scents or smells which are not there. So mkona mtu mnakula githeri anasema na hiyo choma iko wapi amnipati na hakuna choma. They have what we call olfactory hallucinations, smelling things which no one else is smelling. They may also feel things crawling on their skin. Unaona mtu amejaribu kujipanguza skin anasema pana kuna kitu inanifanya nini? Heke dokera daba na kuna kitu. Right? So they have those hallucinations. Then they also have what we call delusions. They strongly believe in something which is not true. So nasema mimi hapana, mimi siwezi panda hiyo gari ya huyo dikon fulani anaenda kuniua. Ama hiyo chai umepewa na nani? Na sister nani? Hapana usikunywe. Ameweka kitu kwa hiyo chai utamfuata kwake. And you cannot move them from there. They become delusional, right? Now, if you have those symptoms for at least 6 months, then we diagnose you with what we call schizophrenia. Now, there's a very thin line sometimes between mental health issues and what we call demon possession, right? So when it is within the church setting, we can only go as far as medicine goes. We say that, yes, you can pray for someone, but also have that self-awareness to take this person to a medical facility. Msiachie pastor aombee watu sana. Unaomba, huyu mtu abadiliki. How about you also do a what? a medical evaluation, because the symptoms could actually be a mental health illness, right? And remember, we are saying they are seeing things. So they could be even saying they are seeing spiritual things. Na unasema huyu dada mandugu na kwangu wa kiroho sana. Okay? And I'm saying this in a very serious environment within the church, because we do have that. Now, what we say is that, yes, this person could actually be very spiritual, but look at the behavior. Because change of behavior will inform you as to the person's mental health situation, and then take them to a professional. Now, maybe one more on substance use disorders, which we will look at. And substance use disorders could be alcohol, it could be marijuana. How many of us have seen marijuana? Bangi. How many of us? Not used, eh? I said seen. Yes, it is very, very prevalent, right? And we will have children. If I had the NACADA report, I would have shown you children as young as 8, actually 6 to 8 years, are being done what? Are being introduced to these drugs, bangi. So they are given cookies during birthdays, napewa cookies. Watoto nakuja kwa nyumba wamefurahi, wanaruka, uelewi ni nini watoto. Wanakwambia wametoka wapi? Wametoka birthday. Kumbe ni nini wamewekewa kwa hizo cookies? Wamewekewa bangi. Now, the sad thing about addictions is that they begin very slowly. So you will start with one roll of bangi. You say it is experimental. And while I'm at it, alcohol, bangi, the earlier you start using, or the earlier our children start using, then the harder it becomes for them to recover. Because we ask them, at what age did your child start using? They say 14. And you really feel this is a really hopeless, not hopeless, but a very hard situation. Because the earlier you start using, then the harder it becomes for you to do what? To recover. So you start with one roll, right? And when we ask them, why are you taking bangi? They say it relaxes me. It makes me feel nice. Ama inanisaidia kudeal na nani? Na mzae. Si ndio? Pengine the connection channels between yourself and your children are not very good. So the child takes bangi to help them cope with the situation at home. So akianza na one roll of bangi, at some point, effect inaisha. So they need now to get the same high they got when they took the first roll. Before you know it, you're taking 5 rolls of bangi. Now, I've mentioned schizophrenia, and we will discuss where it comes from. Schizophrenia is very genetical. If, for example, you have someone in the family history who had schizophrenia, then you have a likelihood of becoming someone who is suffering from schizophrenia. Not absolutely 100%. We are saying you get a likelihood, okay? There is that schizophrenia now, which is induced by taking substances. So huyu mtoto, hakuna shida ya schizophrenia in the family at all, right? But amevuta bangi mpaka amefanya nini? Ameanza kutembea bila nguo, anaongea, kuna watu wanaona, nasikia vitu zenye watu wengine wafanyi nini? Hawasikii. Induced by those drugs that you're taking. So if we go to the next slide, what would be the causes of mental illnesses? And there are many, I'll not run through them. But number 1, there is genetic predisposition. We've all heard of blood pressure, high blood pressure, right? Diabetes, the things which we say run in the family. Uko kwa kuna kwanga na blood pressure. And sometimes when you go to the hospital, they will ask you, is there blood pressure, a history of blood pressure problems in the family? Now, the same way you have blood pressure, you have diabetes within the family, is the same way you'll have things like schizophrenia, bipolar, and other mental health illnesses. But we are not saying that you must get depression simply because your mother got depression, but you're at a higher risk or a higher likelihood as opposed to someone who has got no history of depression in the family history. So how do you manage then, if you have that history, to keep yourself from getting depressed? Now, we will look at that. Then number 2, it could be exposure to toxins, especially if a woman is pregnant and she's taking something like alcohol, right? It will impact on the baby. Then you'll get neurodevelopmental disorders. Then we also have what we call adverse childhood experiences, poverty. Yeah? And unfortunately, if you grew up in an environment where there was poverty, of course you have then less access towards resources. For example, resources towards education, resources towards medical covers. So even if someone is experiencing a mental health issue, they're not able to have it addressed because of poverty. So when we talk about adverse childhood experiences, we are talking about things that you experienced growing up. Those things have a very huge impact on your mental health, right? Maybe you grew up with absentee parents. Maybe you grew up with parents who would fight. So for you now, as a son in that family, from a little child, you grew up knowing that the only way you solve problems with a woman is to do what? Is to fight. But are men also being beaten nowadays? Because probably that girl grew up in a family where her father used to do what? To beat her mother. So the only way you know how to solve problems is to fight, right? If you grew up in an environment where your father was an alcoholic or your mother was an alcoholic, then for you, you knew when you're stressed, what do? You go and take alcohol. So we are saying that these things that you grew up with have a huge impact on who you are right now as a grown-up. And sometimes you need to ask yourself, why do I behave the way I behave? Why don't I have patience? Why do I get angry so fast? Why do I get physical so fast? Probably it is what you experienced growing up. If, for example, as a child you were sexually assaulted, that can also bring problems into your life, and you have what we call post-traumatic stress disorder. Stress which was not resolved growing up now catches up with you. So you have nightmares, you have flashbacks, you cannot relate as a married man or woman because of what happened in your youth, in your young age growing up, right? Now, when it comes to post-traumatic stress disorder, maybe I can mention that, you do not have to be the one experiencing it, but you could also witness, right? You could see someone involved in a bad road accident or someone being killed, and then you develop a mental health condition known as post-traumatic stress disorder, where you have nightmares, you have flashbacks, you keep on recalling the scenario as it happened. So other things that could cause you mental illnesses are when you experience loss, right? And loss does not necessarily mean loss of another human being. It could be, for example, you lose your job. And especially in these hard economic times that we are living, when you lose your job and the bills are still waiting for you to clear. So if you're not able to manage, which is why I was asking, if you lose your job right now, would you still maintain the same lifestyle for at least the next 6 months? Because if you cannot, then you'll get so stressed, and the stress is going to put you into a place where you do what? You develop a mental illness. Stress does not cause you to have a mental illness. Your lack of stress management skills is what takes you to a place where you become mentally unwell. How many have seen a pressure cooker? We've all seen a pressure cooker, yeah? And when it gets to a place where there's a whistle, it lets off some steam. Now, letting off that steam is what would be your stress management techniques. Because if that pressure cooker does not have that outlet for the steam, what does it do? It's going to explode. And that is the same thing with a human being, right? Now, remember we said that men are more prone to suicide. I forgot to mention that while we are talking about depression, that men also experience postpartum depression. How many have heard of postpartum depression? Postpartum, when your wife gives birth, then you become depressed. Is that a possibility? Is it a possibility? So why is the man getting depressed? He's not going to the labor ward. Asemi nimekosa maziwa, sijui maziwa itoki. So why is the man getting depressed? When he gets more than one child, right? That could be a source of stress, right? Or depression. Finances, think about it. A new child comes with a lot of things to do with finances. Sindio? A new child comes with amwezi lala the same hours that you are sleeping. Sikanamka usiku kanalia. A new child will also come with now loss of intimacy with your wife because now she's more committed to the child. So una realize that ile relationship mlikuwa nayo sana, saa hii amekuwa committed kwa nani? Kwa mtoto. But what do men do? Wakipataka kwa paternity leave. Wanafanyanga nini? What do they do? Wanaenda Kitengela kuangalia kaplot. Wanaenda sijui kupeleka gari service. But what is the paternity leave supposed to do? It's supposed to help you bond with your child. So now, if you did not see your parents, and especially for those of us who are around my age, Of course, fathers at that time, what are you talking about paternity leave? Si mama amepata mtoto ameenda nyumbani, and life does what? Goes on. But now that you have that access towards something like paternity leave, then you do what? You take time to bond with the children, with the family. So that was as a by the way. So all these are causes of mental illnesses. Genetics, we've talked about adverse childhood experiences. We've talked about use of substances. And there's something which is very medical, which we call brain chemistry. If, for example, you have less hormones, the happy feel-good hormones, they're like dopamine. If your hormones are not balancing, then we would say that you can be predisposed towards, for example, depression. Which is why when you come with those symptoms to the clinic and say, I'm feeling sad, I'm feeling low, we first of all do a medical evaluation to ascertain that this is not a medical issue. It is actually a mental issue. So then how do you diagnose mental illness? And if you look at it, we have 4 Ds. Number 1, the symptoms that you're experiencing must pose a danger to yourself or the people around you. Number 2, there must be a deviance from the society. If you see someone talking to themselves, laughing alone, then there's something, it's bizarre behavior, isn't it? And then the symptoms that you're experiencing must be causing you distress, okay? And then number 4, they must interfere with your daily functioning. So you become dysfunctional. And the symptoms of mental health illnesses are very many, maybe just a few of them. You have concentration problems, you will have mood swings, you will feel sad, you'll start thinking about suicide, you'll also have anger management issues, you'll have extreme mood changes when you are struggling with poor mental health. Now, I did say that stress in itself does not cause you to have a mental illness, but stress can predispose you towards having mental illnesses. If you look at the major causes of stress when it comes to adults, it's things like work pressure or job loss, right? So maybe you are working, and then after COVID happened, very many people were laid off. But does the family still need to eat? Does rent still need to be paid? And the mortgage, right? And maybe you've been laid off, and for one reason or the other, your wife has maybe been a housewife, okay? Or maybe she's been doing businesses. So you're the sole provider. They look upon you for the finances. So what happens when this man comes home? Ulikuwa unaamka 6, ndio uende job, sa unaamka 9. What happens to that relationship, even with the wife? Your wife of even 30 years, very understanding woman, but kazi imepotea. Unaamka saa 3, unauliza kama kuna chai, unasema wekee maji kwa bafu. Hiyo relationship itaendelea aje? There'll be stress, isn't it? Watoto bado watakuitisha fare ya kwenda somewhere, college. Watakuitisha school fees. So what is this poor man supposed to do? Atafanya nini na kazi imekatika? So we have that even in the congregation. Na si atatafuti kazi, anatafuta lakini haipatikani. Bibi anaanza kumuona aje? You know, a woman, unfortunately, can only love a hero. And that is how we are created. We can only love heroes. Hata kama anaenda kwa mjengo arudi na 100, you feel good. Ako na effort. Si mwanaume ni effort. Si ndio? Ametoka kwa nyumba, ametembea, ameenda kwa mjengo. Even if he was doing a white collar job, anaenda kwa mjengo, anapata 500, ananunua nini? Ananunua unga. A woman who is loyal and who truly loves you will be very happy with that kind of a man. Hata kama umeweka tai yako kando, suti kando, umesema my family has to eat. Right? But how many men will do that? How many will leave their suits and ties and say, nilikuwa CEO, nilikuwa mkubwa mahali, lakini kazi imeisha, wacha niangalia hapa niliona kuna construction, wacha nionekana nitapata kitu. Very few. But let me advise you that women only look up to heroes. Right? That is how we are made biologically, yeah? So if my husband starts asking me, what are we eating today, surely, what will I tell him? Ama nyumba, landlord nimesikia nakuja kesho, tutafanya nini? I don't want that kind of a man. I want a man who has it together, who knows. Landlord akikuja kesho, we kuwa najibu. And that is how women are made. And if we would understand the biological wiring of men and women, we would have even less problems that we are bringing to the church elders. So work pressure or job loss can be a very a very big issue. Relationship problems. Now, we tell young people before marriage in premarital lessons that mapenzi haitoshi. Love is not enough. Don't say, I'm so in love with this sister or this brother, kila kitu, the rest we will, tutapanga huko mbeleni. Utapanga, panga kabla, uolewe. Because even before you get married, you need to understand there's the issue of children. See, we all hope when we get married we will get children, isn't it? Mtoto akikosa kukuja, tutafanya nini? Tutaachana. So you need to discuss things like children. Where will we live? Pengine unaoa msichana yeye anaona mnaenda kuishi Lavington na unaona pesa yako inakufikisha wapi? Inakufikisha wapi? Pahali tu kwenye mnasema, Si ndio? So you need to discuss those kind of things. Things about religion. Where are we going to worship? Because those things are going to become the elephant in the room. Once you do what? Once you get married. Income. How much are you earning? What is your expectation of me as your wife in terms of contribution? Because all these things will give you so much stress within that relationship. Mtaona tumekuja hapa, tumekula pilau, a year later watu wamefanya nini? Wameachana. Simply because of the stress that escalated, ukoona mtoto wako amekuwa depressed na mwambia hapana, we rudi nyumbani. So how are we as parents also advising our children? And when we talk about now relationships, because the stressors from relationships will lead to a place where you get mentally unwell, how are you relating with one another? How are you relating with your children? How many of us take time to have supper, to make it a habit to have supper with our children, at least, hata kama ni 3 days in a week or 2 days in a week? Ama ikiumana kabisa on Sunday, tukule lunch pamoja. How many of us? Which is why we have, isn't it? At least once a week, right? So you're able to talk to your children, to understand them, to know who is this. And when it comes to the art of communication, you must talk with your child, let them respond. We call them the 3 T's of communication. You talk more, spend time with them, you tune into their world, right? Sikuambia mimi sijui watoto wa siku hizi mkoaje. You need to know where are they behaving the way they are behaving. Because then what happens? The children move on to do what? To take in drugs and other substances. And then you start blaming your child, whereas you're the one who did what? Who was not present for them. So relationship challenges can be a big thing that leads you towards having poor mental health. And then, of course, we have things like parental separation or divorces, and sometimes they are inevitable, okay? Which is why it is important, even as you're counseling people who are going through marital challenges, to understand, is it personality, or could this person actually be having a mental health illness? Because we do have, for example, an illness which is a personality disorder called narcissistic personality disorder. This person is never wrong at all. Hata mkikuja kwa pastor ulize shida iko wapi, atasema ni bibi kila saa. Si yeye. Ama bibi anasema kila saa ni bwana, ajionangi. So pastor anajaribu kusolve. Kumbe this person is actually mentally unwell. And you don't want to get to a place where someone becomes so depressed until it moves to what we call psychotic depression. Psychotic depression, anaweza amka tu siku moja asubuhi ama usiku afanye nini? Amalize watu. And this person is actually depressed. Because amesukuma na hii relationship, anasukumiwa relationship na mtu mwenye ako na personality disorder, this person, the depression goes over and above and they become what we call psychotically depressed. They have a psychotic episode. So relationship challenges, ask yourself, how are my relationships with my family, with my friends, with myself, with my workmates? How are my relationships? Of course, worries of finances. Pengine uko na kanyumba kadogo, pesa haitoshi, and you're not able to move to a bigger room. So you're sharing the room, maybe even 1 bedroom or 2 bedroom with your children, with your wife, and it becomes very hard even for you as a father. You're hoping, you're aspiring, you're dreaming, but those dreams are not coming to fruition. So, unasukumana, poverty levels, and of course, when you're now marginally disadvantaged, then we've said that mental health illnesses are more likely to do what? To happen. Sio kusema ati watu wenye wako na pesa wananga mental health issues. Do we all have mental health issues? Do we all have mental health predisposition towards mental health illnesses? whether you have money or you do not have it. Now, for the children, the stresses they could be encountering are those things like parental separation or parental divorce. But if you're co-parenting, because we also have single parenting within the church, how are you doing the co-parenting? How do you talk about your significant other in the presence of your children? Because some people will demonize their partner. Baba yenu nakuanga, mama yenu nakuanga. So the children grow up with a lot of mental health disorders. They start acting out in school, they have discipline issues, and they slowly move on into taking things like drugs and other substances. So the backbone of any society, if you can go to the next slide, is actually the family. So if you're able to understand the stresses that will disintegrate the family, then you're able to understand how you can maintain your mental health. And these are the family stressors. The next slide. We've talked about financial challenges, experiencing losses, the birth of a child. We've said it can also be a stressor, divorce or separation, parental relationship issues, physical illness of the parent or the child, mental health disorder of a parent, parental responsibilities, changes in living situations. But how do you handle all these financial stressors? And we are saying, number one, maintain self-care. Number two, seek professional support. If you feel, for example, your partner, your child is experiencing mental health illnesses or symptoms, then you do what? You seek professional help. Learn better ways to communicate. We've talked about communication. There is what I am saying, but how am I saying it? Your husband or your wife can tell you something, and how they are saying it depends on how you interpret it, based on their body language, their intonation. So learn better ways to communicate. Foster a healthy self-esteem. How do you feel about yourself? What is your self-worth? And remember, how you talk to your children will determine how they feel about themselves. You may tell this child, you've not performed well, mbona umepata B+, mtoto fulani alipata A-, unafanya huyo mtoto aanze kufanya nini? Kujichukia. And they love themselves less. Then practice relaxation techniques. That one we can talk about in another setting. Also, revisit your parenting style. How do we parent? Right? If you look at this slide on parenting, we have, the next slide, we have parents who are very permissive. What the child wants, the child gets. How many of us have seen those children who throw themselves kwa supermarket, analilia kitu amejiangusha huko chini kwa floor ya supermarket? What does the parent do? Kababa generation. Kababa ulikuwa unataka nini? Chukua tu. Because you're so embarrassed as a parent. Huyo mtoto ataendelea hivyo. Si ndio? Whatever that child wants, even when they're teenagers, they will do what? They will get. So look at your parenting style. Are you permissive? Right? Are you very, very afraid of confrontations with your children, so you allow them to have what they want? But then again, remember, it's not just about you as a parent, right? It's also about how the children perceive you. But you as the parent, you're the one who creates that environment. The best type of parenting is what we call, is which one? We call it authoritative. Now note, there's one called authoritarian. Authoritarian parenting is either my way or the highway. You will do it because I'm your parent, because I said so. Don't ask me questions. You will go to this school and not this school because I said so. Where is the voice of the child? Even when you read the scripture also says fathers. And by fathers, it also means mothers. Do not do what to your children? Do not do what? Provoke. Do not provoke your children. Have you ever asked yourself as a parent, how am I provoking my children? What are the things that I am saying or doing that is construed as provoking or annoying or stirring up the child? So you can have permissive parenting, which is wrong, and involved parenting. You don't care. You don't know who your child spends time with. You don't know who they hang out with. Wakikwambia nimetoka nitarudi saa ngapi, ujui ameenda wapi. You're a very uninvolved kind of a parent. So when the child gets into substances and starts taking bang, you ask yourself, huyu mtoto amekuwa kama nani? Ni juu kumpatia nini hiyo wakati? And then there's now authoritarian. We've said you have very high expectations, but it is very autocratic. You only punish your children, you beat them up. Now, a child who is at least 9 years old, up to about 7 years old, you can maybe pinch. But from 7 going on to 8, try and have a conversation with that child. Because children will develop self-esteem issues, they develop anxiety. Unaona mtoto mwenye akuwa na, they were not wetting their bed, they start doing what? They start wetting their bed. Because what happened? Daddy beat them or mommy beat them. So they become very anxious children. So they become retrogressive. So the authoritative kind of parenting is the best kind of parenting, where you have high expectations, but you set clear standards. It is also democratic. You discuss with your children. So you said you want to go to this school. Why not this particular school? As your parents, we were thinking this one is better, but which one would you want to go to? Of course, hatusemi ati watoto hawakalie. There's usually a very thin balance. Now, if you look at stress, how it affects you, now your body, you will find yourself going to hospital. Utajipata umeenda clinic mara kama 10 kwa mwaka mpaka insurance is exhausted. Why? Because you're having physical symptoms which are actually stress-related. Why? Because when you're stressed, your immune system goes down and you become very susceptible to infections. So uko na homa, uko na headaches, you have chest pains, you have fatigue, you have muscle tension or pain, and the doctor does a wellness clinic. Wanakuangalia kabisa na hakuna shida. Nini uko nayo? Ni stress. Ukikosa kutatua hiyo stress, utafanya nini? You will slip into a mental health illness. So we usually think that when you're diagnosed with a mental illness, straight up unapewa nini? Unapewa madawa. So ukianza kukunywa madawa, tunasemanga yule ni wa nini? Ni wa dawa, no psychiatry. That's what we call people. That's stigma. But we do not give medication as the first line of treatment. First of all, we do a very good comprehensive assessment based on the symptoms. Then if it is therapy, we do therapy. But if someone comes to us now with the symptoms for schizophrenia, then straight up we do what? We give them medication. Because then now that one, you will actually need medication to contain the person. So you also need to take care of your own mental health. Do things like setting boundaries, right? Be able to tell yourself that I will associate with so-and-so because they help improve my mental health. You know, there are people who put you down all the time, people who have very negative energy, and they affect your mental health. So set boundaries. Do things like exercising. Exercising has been seen to help you with your dopamine levels. You have the good hormones, and they help you be able to balance your mental health. Do things like meditation, challenge and helpful thoughts. Ask for support from friends, family, and community. Now, men do not talk, and that is a very big problem. Men will die with their problems because how have we raised up the boy child? When he's in pain, anaambiwangu asifanye nini? Asilie, mwanaume ni kujikaza, wanaume hawaliangi. So they grow up from very young people, very young boys, to know that for me to be called a man, I cannot be able to show tears or express sadness or cry. So let us encourage our men to talk. If not cry, cry when you need to, right? Because if you lose someone who is very close to you, do we have the same emotions they have? So you will want to cry, but you don't want to see your man crying. I think let us encourage them to be able to express themselves, right? And then also connect with others. So why do we not seek help when we are going through mental health issues? Number one is the stigma and embarrassment. Because if I am so depressed, I am thinking of killing myself. Ata pastor nitamwambia hivyo kweli? Ataniona aje? Will I even be able to talk to my colleagues and tell them I'm having very depressive thoughts? I will not be able to do that. Number two, problems recognizing symptoms. Things like poor sleep patterns. If your sleep patterns have changed, ask yourself why. If your appetite has changed, ask yourself why. If your motivation towards things you previously enjoyed has also changed, ask yourself why. And then preference for self-reliance, especially with men. Men will struggle with a mental health issue and say that I will manage, until they break down and then they find themselves admitted at a mental health facility. Confidentiality and trust. Aujui, nikiongea na sister fulani, alafu nione wamesimama na sister mwingine, sintafikiria ni mimi wanaongelelea. So you have issues of confidentiality and trust, but take your issues to a professional. And then, of course, the feeling of hopelessness. No one can help me. Hii shida ni kubwa sana, hakuna mtu anaweza fanya nini? Anaweza nisaidia. So as we wind up, there's the issue of stigma. So there's what we call people who are experiencing mental illnesses. Anakuanga wadawa, kwao ni kwa watu wa psychiatry, we ujui hiyo familia inakuanga na shida ya mental health issues. So if we can normalize the conversation around mental health, then that would help people become more accepting of people who are experiencing mental health illnesses. If you yourself are going through it, you can become a mental health champion by talking about your own lived experience. And like we said, it could be me, it could be my colleague at work, it could be you sitting there listening to me who could be going through a mental health illness, right? So how do we take care of ourselves to ensure that we do not get to a place where we get mental health illnesses? If you can go to the next slide for self-care, the next one. So there are what we call the 8 dimensions of wellness. So number 1, we have spiritual wellness. People who are more spiritual, research shows they're less prone to suffering from mental health illnesses because they will pray, they believe in a higher power that will resolve their issues, so they're less prone towards having mental health illnesses. So spirituality is not always about church. It's also about having a purpose towards life. Who am I? What am I looking towards in life? What is my purpose? And that will help you with your self-care routine. Number 2, social. I asked, how many of us have got 3 good friends? If you're in a fix, if I call them, they will come running. Social capital is very, very important because you feel connected. Then also connect with your wife, with your family, with your children, with your friends in church or friends from wherever. Social capital is very, very important. And the less stress you have around social relationships, then the better your mental health. When it comes to finances, you need to ask yourself, how financially well am I? Because this is a very big part of your mental health. If you realize your mathematics is not adding up, you've got more debts than the money that you're having in your pocket, it can be a very big source of stress, which can put you into depression or into anxiety or trigger an underlying mental health condition. So ask yourself, am I satisfied with my current and financial situation? Am I someone who is given to gambling? We have very many people doing gambling. Kuna watu wa cryptocurrency. Ask yourself a few questions around that. Mtu ako na mshahara, analipwa 300,000 at the end of the month, but ananga kitu. Ako kwa nini? Kwa gambling, ako kwa crypto. So ask yourself, am I making sound financial decisions? Things to do with emotional wellness. How do I manage my emotions? Am I the kind of person nalipukianga watu? Ama tumekosana na bwana mabibi, nikifika ofisi na project hizo makasiriko kwa watu wenye wako kazini, ama kwa watoto, ama kwa wafanyikazi wengine. Then intellectual, kuna mahali nimefika nimesoma, lakini naweza ongezea nini? Maarifa. Hata kama it is something creative. During COVID, very many people realized they had talents. Mtu akapata haya, I can actually cook. Mwingine akaona naweza fanya kazi ya Uber. Mwingine akaona naweza fanya kazi ya grocer. So you realize something about yourself that you did not have, which helps you also build upon your creativity. Physical wellness is very, very important because now you're able to exercise, go to the gym, eat well, sleep well, and that does a lot for your mental health. And then also occupational, finding personal satisfaction and enrichment in your work. Hata kama ni wewe umejiandika kazi, are you happy going to work every morning? Or are you wondering, hii wiki itaisha saa ngapi ndio utoke huko kazini? So one thing I may mention before I sit down is when your child is maybe taking drugs or alcohol, what are the signs? How would you be able to tell? Now, we have them in different dimensions. You can see physical signs, you can see behavioral signs, and you can also see psychological signs. When it comes to the physical warning signs that your child or that brother or sister who you care for is taking some substance, number 1, you'll of course have some unusual smells around them, especially things like bangi. Ukivuta bangi kuna venye nakwamianga kwa nguo. Si hata mtu akivuta bangi ukipita hapo kuna hiyo harufu. Ama cigarettes ama pombe. So you may have some unusual smells around the person. Number 2, their personal grooming goes down. Mtoto wako alikuwa anavaa vizuri kabisa, ameanza sasa kuachilia manywele, ameanza kuachilia mandevu, they're not cleaning themselves up. So their personal grooming goes down. Ukiangalia macho ya huyo mtoto, they have bloodshot eyes. Macho imekuwa red. Unamuuliza ni nini, nasema ni allergy. Na sasa hiyo ni bangi amefanya nini? Amevuta. Changes in appetite. Now, ukivuta bangi, unaweza kula sana. It gives you an appetite. So unashangaa huyu mtoto anashinda kukula. But now be very careful. Usione mtoto wako anakula sana useme huyu pengine anavuta bangi. Hapana. You have to look at all the symptoms together. So they may have a change in appetite. Either kule sana ama akatae kukula. Then their sleep patterns may also change. Someone analala mpaka saa 5, saa 6, unashangaa ni nini? Mtoto amelala. And then they may also have tremors or impaired speech. Akiongea ni kama na stammer, right? Unashangaa anaongea ushiki kabisa venye anasema, they are stammering or they having tremors, wanatetemeka mikono. Anajaribu kuficha mikono hivi unaona hapana, hiyo mikono ya mtoto inafanya nini? Inatetemeka. When it comes to know their behavior, they have a sudden change, especially in the friends or the hobbies they have been having. Alikuwa anaenda na mtoto wa dikon fulani, sasa wameachana. Because birds of a feather, they flock together, right? Sudden change in friends, hobbies, ama kwenye hata anaenda kuhang out. Alikuwa anaenda kukunywa kahawa maybe kwa mall fulani, sasa amebadilisha naenda mall ingine. Then they may frequently get into trouble. That could be a sign the child is abusing drugs. A drop in performance, they could also be having secretive or suspicious behavior. Wanasikia umeingia kwa nyumba, unasikia watu wamekimbia kwa nyumba, unashangaa ni nini wanafanya nini? Wanaficha. Very suspicious behavior. And then when it comes to psychological warning signs, unaona mtoto amekuwa na mood swings. Now, adolescents usually have mood swings, but now when it's coupled with drugs and substances, they become more severe. Unamwongelesha akuongeleshi, unashangaa ni nini mtoto, ama unasikia akiongelesha mamake vibaya, very moody, right? They may also become very agitated or they become hyperactive. Unaona mtoto hawezi tulia, anaketi anaenda hapa, anaenda bedroom, anatoka anakuja sitting room, anatoka nje. Hyperactivity because of what is going on in their system. They may also become very anxious. Anxiety inamaanisha ukimwambia afanye kitu, unaona ameanza kusweat. Kama unaweza mguza hapa kwa roho, unasikia amekuwa na a lot of palpitations. They become sweaty. Unaona anataka kukimbia kwa washroom because anxiety is also a disorder. And they may also have no motivation. Sometimes ukimwongelesha, unaona amekuangalia, unamuuliza no iwedauga. Anasema ni daigua because they are kind of spaced out. So it could be that the child is abusing drugs. But how will you know as a parent unless you're in touch with the child? For you to notice a change in behavior means that you already know how they behave. So that change in behavior could tell you that maybe something is happening. Sawa. So I know we've gone through very many things, touched here and there, but in a different setting, we can probably pick one topic like alcohol and drugs and then run with it. Pick one topic like parenting, run with it. But for now, that is basically the foundation of mental health and wellness. And unless there's a very, very burning question, then I'd like to hand it back to Madam Jerry. We agreed we can. One or two questions, if at all there are any. Yes.
At the courses, there is somewhere you've mentioned poor nutrition dash omega. And we know omega in different ways. If you can kindly expound on that. Thank you.
Let's go back to that slide, please. Up. I think think it's there, right? Poor nutrition, lack of certain nutrients growing up, such as omega-3, right? Now, we all know omega-3 is a fatty acid. And what it does when you take it, it promotes the buildup of healthy bacteria. So healthy bacteria, when it comes now to the hormonal, I mentioned in passing the neurotransmitters. Now, if you have an imbalance in the chemicals in your brain, for example, you may be predisposed towards depression or another mental illness. But if you take healthy foods like omega-3, for example, they promote good bacteria, which in turn promotes the production of chemicals, which in turn promotes mental health. You get the flow? Yeah. That is why you keep on being told, pateni watoto kichwa ya samaki. Unaambiwa watoto wajaluo nakuanga nini? It's not actually a myth, it's true. Yeah? Nutrition has a big bearing on your mental health. When people are depressed, they do what we call comfort eating. Unapata mtu akona depression, anakula crisps, anakunywa Coke, anakula pizza, anaenda KFC and wherever, because those foods give you a very good feel, a sugar rush kind of, cakes and sweets and what have you. But zikiisha kwa mwili, you feel more depressed than you felt at the beginning. So nutrition plays a very big role on your mental health. Thank you for that question. Any other question? Yes, Chair?
Sorry, mine is not a question, but seeking clarity. The information you've shared with us is quite a lot. We may not have grasped everything, or even 20% of that. Can we access this information? Could you give authority for us to access that information?
Yes, absolutely.
Thank you.
There's a question. Oh, okay.
Praise God.
Amen.
Thank you very much for the information. I would like to ask what are you doing as Chiromo to cater for those people who are in the slum area? You find that, like me, I'm one of the people who is concerned in my village to do some issues concerning maybe drug addiction and whatever. But you find that Chiromo is a bit expensive when you take somebody there, 1 million. And so what people are doing in the village, akijua mtu ni mgonjwa, anaanza hizo mambo. Wanamfungia na wanamfunga. So sisi kama health workers, when we are going there, tunapata mtu amefungiwa, unaambiwa mwangalia na hapo, tumemfungia, ako pale. Sasa wewe ndio utaingia, utapata mtu anapatiliangwa chakula chini ya mlango, alafu anarushiangwa nguo, kwa hivyo kila nguo anavaa, anarushiwa, anavaa juu. So I would like to ask whether maybe you can have some in the village, mkuwe na pahali watu wanaweza seek that information, and let it be a village setup yenye maybe counseling can be done kwa watu wakiwa pahali wako, maybe na ikuwe a bit cheaper. I think even to have a medical setup ya hiyo mental health kwa pahali watu wako karibu. Juu watu wengi, juu ya stigma pia, wanaanza kuona ni kama wataweza kuenda kusema kuhusu watoto wao, kuhusu brothers, mama zao. May God bless you. Thank you.
So thank you for that. Well, just to clarify, a million hapana, hatufikishi huko. Hiyo utakuwa umekaa hospitali sana, right? Well, we do take most, if not all, insurances. And if you look at your insurance cover, for those of you who have insurances, probably the ones who are working formally, then you are covered, even if not with Chiromo, with a mental health facility for counseling. Right now, there could be doctors seated here. In most of the county hospitals, we have a psychiatrist and a psychologist. The government has really tried to implement that. The sad thing is that out of the national budget, and I think I had those statistics, there was a mental task force which was convened in 2019. And they did find out that I think 20% or 25% of people who are inpatients are actually there because they have a mental illness which is not diagnosed. So I have depression, and it has gone to a place where it becomes medical. Because if I have depression, then I'll probably get what? I'll probably get ulcers, right? So you're there admitted, not because of the depression, but because of the ulcers. The task force also found out that 40% of outpatients are there not because of what they're saying, nasikia niko na homa, naumwa na mgongo. It is because of a mental health condition which has not been diagnosed. Now, the sad part is that the national budget for mental health is about 0.0%. I can give you access to the mental health report and you can take a look at it. But what are we as Chiromo doing? Exactly what I am doing today. We are more about promotive and preventive factors as opposed to curative. What do I mean by that? We do not want you to get sick so that you come to Chiromo, so that we have business. Sindio? Tunakuja kukwambia, apana, kula vizuri, ongea na watu ukikuwa una stress, ukisikia pengine you're having depression, talk with someone and maybe the depression will lift. Kabla ujipate wapi? Ujipate Chiromo. So we will go to the villages. We do go, and you can invite us, and we go there and we tell people this is what mental health is all about. But we need to normalize that conversation around mental health, especially because of stigma. So mnasikia venye watu wanaekangwa mtu akiwa na mental health illnesses. Unafungwa with a chain, and they put you in the house, especially in the villages. What she's saying is very true, because you have a mental health illness. If you come to a facility, not necessarily Chiromo, but where they are treating you with a good psychiatrist and good medication, you will see that person who was being chained has come back to themselves. Na amefanya nini? Amepata nafuu, na amekuwa a useful person in society. But why are they being chained? It's because of ignorance, lack of education, lack of knowledge, lack of knowing the symptoms of poor mental health. Which is why now we are trying to talk about it, to tell you these are the symptoms. Ukiona mtu akona hii shida, mpeleke wapi? Hospitali. Kuna Mental Health Act. Mental Health Act has allowed you, kama uko na bibi, mwenye unaona kabisa huyu ni symptoms za mtu mwenye kichwa iko sawa, inakuruhusu kumpeleka literally by force to a mental health facility. Are we together on that? The Mental Health Act. If you have a child, a spouse, a partner, someone who you feel is ruining their lives because of a mental health illness, which they have refused to acknowledge. Because for you to seek help, you must come from a point of acceptance. Useme enyewe na kuanga na nini? Na depression. Na kuanga na schizophrenia. Then I will seek help. Lakini ukikosa kutafuta hiyo usaidizi, bwanako, bibi yako, your child can actually take you to a mental health facility, na hiyo facility kushikilia for not less than 72 hours. Ndio utibiwe. Because then again tunasema, mtu mwenye ako na mental health illness, kichwa inaweza mwambia chukua kisu, fanya nini? Ua hao watu. So you become a danger to yourself and to the people around you. And when you have, for example, psychotic illnesses like schizophrenia, hizo sauti unasikia, azikwambie enda ulale, enda uimbe kawimbo, inakwambia enda ushike huyu mtu nyonga, ama ruka kwa hiyo gari. You know, they always tell you wrong things. They always tell you bad things. Which now, in your state of being unwell, utaenda ufanye nini? Ufanye hizo vitu. Even when women have delivered, they can have what we call postpartum psychosis. That is when you find a woman will take a child, mwenye amezaa afanye nini? Anyonge, ama arushe mahali, ama, you know, because of the postpartum psychosis. Mtu kama huyo, mnaweza fanya therapy? Amwezi. Unaweza mwambia we tuliza? Hauwezi. Unamshika kwa nguvu, unampeleka wapi? To a mental health facility. So yes, we are there at the grassroots. If you want my number, you can take from Jerry or from Alice, and we'll be able to come and do what we are doing. So I've spoken enough, I think. And with your permission, unless there's a very burning question, then I can take my break. Thank you. Actually, I forgot something. We do have self-assessments. I'll leave them with Njeri and Alice. Now, these self-assessments, you see this QR code. You can scan using your scanner, your Google camera. It will bring you a list of assessments for depression, for anxiety, for alcohol, and then itakwambia level zako, wewe ungeenda na Victoria Chiromo. Ama ikwambie, wewe uko sawa. It is not diagnostic. Usiseme mimi niko na depression. It is a pointer. It's like there you have the machine for blood pressure. Ukijipima, si unajiambianga mimi niko sawa, acha nikakae kwa nyumba. Ama unasema hapana, hii pressure wacha nipeleke hospitali. It's the same thing. Sawa sawa? So she will probably distribute them, and I hope there'll be enough.
Wow, where do we begin? I think we need to put a good round of applause for Victoria for such a wonderful word. Let's go. 1, 2, 3. No, let's do factor 5 for her, isn't it? Okay, you know factor 5? Let's start. 1, 2, 3, 4, 5. 1, 2, 3, 4. 1, 2, 3. 1, 2, 1. Wonderful, wonderful. Thank you so much, Victoria. You have taught us. The book of Peter says that we must increase in knowledge. Have we increased in knowledge?